The goal of this presentation is to, one, talk about St. Mary's and all the work that the agency does around data and why we do so, and then talk about why organizations should invest in data. What are the benefits of doing so, and what can it give organizations when they put in resources into building up the overall data infrastructure? So, just to quickly go over the agenda for today, first, I want to talk a little bit about the history of data at the St. Mary's Center from the 2000s up to today. Then I want to talk a little bit about how St. Mary's is using its data today and what does that look like. And then I want to spend the most of my time focusing on why to invest in data and what are the benefits an organization can get out of it when they spend those resources to build up its data infrastructure and to really make sure that it has a really robust data system as a whole. So for the presentation, my goal is to spend the next probably 15, maybe 20 minutes at most talking, and then leave the rest for Q&A at the very end. So please feel free to ask, if you have any questions, feel free to put them in the chat as I'm going along, and I will answer those at the end. And then I'll also open the floor if anyone wants to ask any questions as we go along, after we finish the presentation. So before I jump into my full presentation, just a little quick note on who St. Mary's is and a bit about myself. St. Mary's, we are a nonprofit that serves seniors aged 55 and up in Oakland, California. And we serve seniors on a whole host of different services, from everything from intensive case management and transitional housing, all the way down to congregate meal programs and fun events to keep seniors engaged and connected with one another and their community. The agency just celebrated its 50th anniversary this year. St. Mary's has been in the business of trying to help seniors for 50 years, and it's cool that the agency has hit that milestone. And we as an agency serve hundreds of seniors annually through a whole host of services, and we have a very diverse, very large population who we work with, who all have their own unique needs that St. Mary's really works to try to cater to and support. And a bit about myself. I am the current director of contracts and data for the St. Mary's Center. My work is basically managing all of our contracts and supporting all the data work that is done at St. Mary's Center. I've been with the agency for about 4+ years now. And before I came to St. Mary's Center, I was getting my joint degree in business administration and public policy at Mills College in Oakland. And that program is what led me to St. Mary's Center today. So to just jump right in for a quick and brief history lesson of data at St. Mary's Center. In the 2000s, St. Mary's Center really was trying to use data to focus on what they called evidence-based work. The idea for St. Mary's at the time was they understood the importance of data, but they also understood the importance of using it to drive the impact metrics and to develop those metrics themselves. Rather than, let's say, the agency just deciding, hey, this is the impact that we want to have, the organization really worked with their clients to get a sense of, hey, what does impact look to you? And collect data on that, and then use that to drive how the agency did its work and how it tracked those metrics. In 2007, an organizational psychologist wrote an article in an academic journal, Health and Social Work, where they talked about the St. Mary's program and specifically talked about how St. Mary's was a bit ahead of the curve in terms of a lot of social services agencies in terms of using data that way, to really use data as the driver of how it looked at impact and then use that to push itself and push out the programming to support those impact goals. In the 2010s, Dr. Margaret Cushell, who is a professor at UCSF, she received funding from the National Institute on Aging to do a vulnerable population study, specifically on individuals who are homeless over the age of 50. And Dr. Cushell chose St. Mary's as basically the hub for her research in terms of she used St. Mary's as their base operations and also used the organization to supply her and her team many of the clients that they studied. And St. Mary's did this not just one because they understood that being able to connect Dr. Kuchel's team with the clients would lead to potentially positive benefits for the clients themselves, but also because the agency understood the importance of supporting projects like this. The better data that St. Mary's could provide Dr. Kuchel and her team, the better her and her project could understand the real plight of homeless seniors, and that information could then be used to really affect policy throughout not just Alameda County, but also throughout the state of California with the research that Dr. Kuchel and her team is doing. So again, St. Mary's was really focused and understood that data and having good data can really be helpful and impactful on the whole. But even not just within St. Mary's, but also outside of itself. And then in 2020, the data team was formed at St. Mary's. Due to the pandemic, there was an increased need to really build out the data infrastructure at the agency. So an entire department was developed to support that need. One, obviously, because so much had changed due to the pandemic and our data needs shifted, but also two, the agency recognized that they need to put a little bit more funding and support towards data to help the agency take itself to the next level. So what does data look like at St. Mary's today? As I said before, St. Mary's has our data team, which is a team of 3 staffers, including myself, who really manage all of the data that St. Mary's Center collects and manages. And this is across all of our programs and across all teams at the agency. Along with that team and the work that team does, we've also built out a really robust data entry structure to really support all of our frontline staff who are collecting data and pulling the data that we as a data team manage and work with, but also to help make sure that the data that we're collecting from our clients is data that will lead to tangible benefits for our clients in the long run. And we've also really built out some policies and procedures to really make sure as an organization we're living up to those high standards of client confidentiality. We're living up to standards around making sure that we have a robust system to manage and support the agency when it comes to using data to build our programs or to understand our impact. And ultimately just make sure that the organization has something to turn to when it comes down to it in terms of data management. Data management can sometimes be a lot more harder to do than just something that you inherently know. Hey, we have this program. We need to get some data here. Or, data management is way beyond just having a clipboard and getting some client's name during lunchtime. There's a lot more involved, and the agency understands that and has really used the data team to build that out. So with all that being said, though, why should organizations invest in data? Why should organizations invest their limited time, financial resources, and other resources that they have to build up their data, to, let's say, have a data staff or data team, or to really build out kind of strong policies and procedures around data management? Well, there's a few things. One thing is I want to talk about the importance of data quality. Good data quality and making sure that your data is accurate and complete and is really telling the true story of what you're doing is really important for any organization. Having good data quality can really help you better understand that, whether or not your agency is doing the work that it's supposed to be doing and how well they're doing as an organization. Being able to look at your data and say, yes, I know this data is accurate, and I know that we served these amount of people in this program, or we had these amount of clients who ended up at this outcome. Having that information and really knowing that it's accurate and trusting that information is essential, because not being able to trust your data really defeats the purpose of even having data at the end of the day. Along with that, data quality is becoming more and more important when it comes down to contract compliance. More funders, both on the government level, but also even in the foundation level, they really care about how good your data is. Organizations are asking questions about, well, how complete are your records? They're asking questions about how timely is your data entry? Yeah, yes, funders do really care about impact. They care about how many people got solved, how many people got housed. Those are still really important data points to have. But more and more people are asking the hard questions about, hey, you said that you had this impact. How can you back that up? How can you know that what you've said you've done is accurate? So having good data quality is really essential going forward because more and more organizations are being questioned on that and being viewed on how well they actually are maintaining the data and how accurate it is as a whole. Um, Along with that, I want to talk about this concept called garbage in, garbage out. It's a little more tied to the private sector, but it's the idea that if you're getting, let's say, poor information or poor inputs, whatever you try to use those inputs for, it's going to lead to poor outputs. If you're trying to, let's say, when it comes down to data, if you're trying to use your data to better understand the impact of your program or to better see how effective it is in terms of supporting clients or staff or whatever it is, if that data is bad, if that data is not accurate, it's not complete, if that data is frankly trash, then whatever you're trying to get out of this is going to be trash. If you're going to try to get lessons learned, if the data is bad and it's garbage functionally, whatever information you get is also, in a sense, going to be garbage. Trusting and knowing that the data you have is accurate, being able to know that your data is good at the end of the day, will actually make whatever you want to use that data for, you actually will be able to get good outcomes from that rather than, let's say, getting maybe flawed outcomes or not really being able to truly know or trust whatever thing you're trying to look into using the data that you have. And just to highlight that point, I want to talk about data quality within Alameda County as itself. So these are some quick charts that come from Alameda County's Homeless Management Information System, known as HMIS. HMIS is functionally a database that all agencies that work with homeless individuals within Alameda County, they're required to put in data about the people they work with and the work they're doing with individuals. And this is done partially due to requirements from the Department of Housing and Urban Development, HUD, from the federal government, but also due to a lot of the requirements coming from city and county funders, and sometimes state and federal too. So these tables just show you kind of right now when we look at Alameda County and its HMIS database, what does the data quality look like? And as you can see, there was a lot of data quality issues here. It's not surprising because there are tens of thousands of individuals within HMIS and those tens of thousands of service entries within that system. But you can see that there's, over 3,000 L's on someone's disabling condition. There was over 2,000 L's on, let's say, client's social security number. There's a lot of data quality issues right now within HMIS. And that's not surprising, just given the bulk of data out there and the amount of information that is being entered into that system. But if you want to look at that chart and you want to filter that chart by St. Mary's Center, at the moment, St. Mary's Center has no data quality issues, at least under these parameters. And the reason is that St. Mary's has really invested in making sure that our data quality is good. And really, as an agency, we can trust the data that we have. That if we need to pull information on, let's say, how many of our clients say that they have a disabling condition, or if, let's say, a staffer needs to pull a client's social security number because they need it for an application for, let's say, a social service program or anything else, our agency can trust and feel good that the data that we need to pull is going to be accurate, and that at the end of the day that we have good information. So, I wanted to show this to kind of highlight St. Mary's commitment to data quality, but also that, by doing this, myself as the director of data can kind of sleep easy, but the agency as a whole can also sleep easy knowing that if we need to use the data for anything, we can trust that data is good and of high quality. Beyond just data quality, having good data and investing in data can really help your organization build its resources up. One is through just being able to tell your organization's story. Having good data and having a lot of robust data can really help you tell, a much more unique and much more, you know, diverse story of the work that you're doing. Obviously it's good to know, how many clients did we solve, or, have a sense of, we solved these many people on this day, but being able to say like, hey, let me paint a picture of what an average participant looks like, or being able to paint the picture of the wide variety and diversity of our population and the different issues facing them, being able to really dig deep and kind of show the full suite of service and support that your organization has given someone. At St. Mary's Center, we have some clients that have been with the agency for more than 10 years. And, through that time, we provided them with many different services and a lot of support over the years. So being able to know those types of things, being able to really show that can really be helpful in terms of telling the real story of your agency beyond just, a quick, hey, yeah, we solve these many clients annually. Being able to kind of make the data that you have a bit more pinpoint and using that to more tell to paint kind of a broader and more detailed picture can really pay dividends when it comes down to, talking about the agency. It can also be a big piece in terms of advocating for yourself and getting more funding, whether it's going to be something like, just, advertising that your service is out there and advertising out to the community, whether it is through doing, let's say, asks of, your funders or foundations, whether it's applying for an RFP or negotiating a service agreement that your agency may have with, let's say, a government funder or foundation. Being able to go back and say, like, yeah, we have really good hard numbers to back up that St. Mary's is a good investment. That if you give us funding, or in some cases give us more funding, you're going to know that we're going to do good work and really have an impact. Sometimes when we think about investing in data, people talk about the investment outside of the financial return. But honestly, the return on investment in data can sometimes be actually financial. It can be bringing in more funding to support your agency and build it out as a whole. And then finally, I want to talk about, using your data to really understand the change and impact that you have. St. Mary's does a lot of different work for a lot of different people. We have our preschool program, we have our food program, we have our leadership program, we have our case management program. I could spend the next minute maybe kind of droning on about all the different stuff we do. But the agency does a lot of great work, but it can be difficult to, one, always keep track of it all, to really know and really get a good sense of, hey, these are really good hard numbers of exactly the amount of work that we did. That, some work that a client took part in or something that a staffer did, we don't want that stuff to fall through the crack. We do want to know how well we're doing and how much we're doing and really have good, accurate numbers for that. And it also plays a piece in terms of understanding what our impact is and whether or not we need to adjust. Are we finding programs that, when we look at the data, they're becoming less and less attended? Why is that? Maybe we need to adjust. Or, hey, we're finding out that clients more and more enjoy this program, or more and more are telling us through our surveys or some of our work, reaching out to them and checking in about what they care about. We're seeing that they're telling us this is what they find is important and what they find is impact. So having good data and really being able to trust that can be really helpful in terms of your organization shifting as it needs to kind of better serve and better lead to positive change for your clients. And it can be really important to help you just better understand the full scope of your work and the full scope of the impact that you're having on whatever community or group of people that you're trying to solve. So just to summarize, I think when it comes down to data and why organizations should invest in data, I think it's important to think about, what does data give your organization? One, investing in data will give your organization good data quality. You have data that you can be proud in, data that is accurate, and data that if you need to use it for whatever purpose you want to use it for, that the data itself is, it can stand on its own and can lead you in positive directions, rather than potentially not telling you the full story or leading you down, let's say, the wrong path because the data just isn't accurate in telling the full story. Data can also help you build your resources, whether it's being able to build out your story and being able to, publicize more about the good work your organization does, or whether you can use it to just advocate for yourself and to look into more funding through different sources. Data can really be helpful in terms of letting you do that and kind of strengthening really your point in terms of how good how good the agency is, and why other organizations should invest their time and resources into you. And then finally, data just helps you understand the change that you're having, whether it's the amount of change you're having, whether it's the change you're trying to have is actually the change that your client is looking for, or whether or not the change you're having is actually leading to whatever impact that your organization wants to go towards. Data can be a major piece in terms of really understanding that and really helping you push the agency in whatever direction it needs to go to better serve the clients that you work with. So yeah, on the whole, investing in data can be, a benefit for your agency just in terms of how it does work, but it also have benefits outside of just the day-to-day work. And I think I hope this presentation kind of explained why St. Mary's has done this, because St. Mary's has definitely put in a lot of time and effort to make sure that we are really a data-driven organization and really have worked to make sure that we have a data infrastructure that we can stand tall and feel good about as a whole. So yeah, that is the presentation part of this webinar. So we have about 5 or so minutes, maybe a little longer, because we started a little late for Q&A. So feel free, if you would like to ask any questions, to either unmute yourself or ask a question in the chat, and we can go from there. I see a hand raised for Lateria. So let me... Anais, can you unmute Lateria? Okay, so I think we're having a little bit of some technical difficulties unmuting you, Lateria. You mind just putting your question in the chat really quickly? While we wait to see if we can unmute Lateria, we can at least Lateria provide a question in the chat. We have a comment and question from Noah. So what advice would you give organizations that don't yet have a data team? What steps can they take to move in the right direction towards evidence-based practices? Well, I think to answer your first question, Noah, I think the first thing is really looking at your organization's current resources and think about how your agency currently manages its data. I know in a lot of organizations, when it comes down to data management, at least like entering data or collecting data is done kind of purely by frontline staff. Frontline staff are the ones that are collecting data and are almost always going to be the ones entering in the data sometimes. Some organizations may have a staffer dedicated to some of that work, but that staffer, may be a part-time position or maybe only part of the overall job of, let's say, doing frontline work or other work along those lines. So I think the first thing to look into is kind of what is your organization's, current model, and what capacity can you actually build in to build out a data team, or at the very least, just a staffer that can, be dedicated to data, managing data, doing things like data entry, running reports for, let's say funders or for, other programmatic needs. That itself is a full-time job. So I think one thing to always think about is, what resources are out there to actually support that type of role in your organization, or what can you do with your agency's current structure to actually kind of build that out and make that more possible. And, in terms of what steps you can take towards the right direction towards evidence-based practices, I would say, one of the first steps is just making sure that your organization has good data and good structures for that. Does your organization have a good and easy way to, let's say, collect and input data? Does it have a database that gives them all the tools they need to do their job? And, if you can get stuff like that, you can then use that to think about okay, how can we use the resources we already have to maybe build out our programs? Whether, hey, let's do some surveying of our clients to see what their needs are. Or, hey, let's look at the data we have and see what impact metrics that maybe we're not thinking about, or maybe we haven't seen that maybe the data will show us, and then maybe we can use that to kind of drive how we use this data and this evidence to build out our programs, or review and shift how we view as impact. So I think it's a multi-step process, and that's kind of its own webinar in itself. But I think, at least in terms of going towards more evidence-based practices, one, spend time looking at your current data infrastructure, and two, think about what data you may need or may have that can support building towards better impact and better understanding. So I see a question from Sarah, but I know Latiria had a question beforehand. So I'll ask Latiria's question, and then I'll follow up with Sarah's question. So Latiria asked, can you tell me what is the most challenging part about collecting data for the agency? I would say the most challenging part, at least since I've been here, is supporting the wide ranges of needs when it comes down to data. And when I say that, what I mean is that data, there's a lot of different factors kind of pushing and pulling us when it comes to what data we need, or what data needs to be collected, or where data needs to go. One is the internal needs for the agency in terms of what is our data policies and procedures, or what are the things that, help the agency have good data efficacy in terms of, how do we, as quickly as possible, get data from, let's say, a client into our systems and make sure that it works and is accurate and up to date. But then it's, conversations about how is data collected or maintained. The bulk of data work, when it comes down to information that goes into our systems, it comes from staff. It's staff doing intakes, it's staff working with our clients. So we need to think about what are the staff needs and how can we better support them, and also create processes to, make sure that the data that they've collected or the data they have is up to date, is accurate, and can be entered in a timely manner. Beyond that, we need to think about what are the needs of director level staff. What does, let's say, an agency's clinical director need in terms of data and support? What do, let's say, an director need or want in terms of the data you're collecting and the uses for it? And then there's the external factors in terms of what is the contractor that we're working with? What are their, requirements in terms of data that you need to collect? Do you need to do it every month or every year? Do they need, let's say, wet signatures on anything you have? Do you need to do everything digitally, or do they need to be, by paper? There's a lot of funders that have their own requirements and their own needs when it comes to data collection you have to think about. So I think for me, the most challenging thing has been trying to take on all these differing entities in terms of kind of their needs, their wants, and trying to fashion a data system and kind of policies and procedures that can overall make everyone happy. It's not always going to be a perfect science, and there's always going to be deficiencies no matter what. But, from my end and the work that I do with the data team is we really just want to try to make sure that we are living up to all the standards that we have to do and make it work for everyone. Knowing, of course, that we're never going to be always perfect when we do that. So then Sarah asked a question about, I'm curious if and so what type of data you collect above and beyond what HMS requires. You alluded to psychosocial data and other satisfaction data. So as an agency, HMIS, they're all definitely a good amount of data that we are asked to collect, but we also collect a lot of data outside of that. One is just data on kind of the client story. I know within our senior housing services program, we do spend time, getting a sense of the client's journey to our door in terms of, a narrative section where we can see how do they get to us. We'll ask questions about some other, kind of more specifics around, information like, who's the next of kin, or where do they last stay, or information that we can use to better support their actual current or physical needs. Beyond that, we also just collect a lot. We try to collect more satisfaction data from our clients. Over the last number of years, not this year, but over the past couple of years, we did some work with our Almost Home program where we did select interviews with our clients to see, how is this program serving them and whether or not the program is really working towards their goals of impact. With our community center program, we do a satisfaction survey every year to get a sense of how well programs are doing, what type of other programs, or systems that our clients may want for the future, and to sometimes just test to say, hey, here's a list of things we're thinking about, ideas that we have. What do you think about this? Does this interest you? Does it not interest you? So as an agency, we do try to collect a bit more information on the client's journey and a bit more information that, things like medical information, other things to help us better serve them in terms of things like case management or other services. But we also try to collect a bit more satisfaction survey and satisfaction information to better understand whether or not our clients really enjoy our programs and whether or not it's really supporting their needs. And going forward, we want to do a bit more of that. One thing that one director once told me is we do a lot of intakes, we don't do a lot of outtakes with our clients. In the sense that when a client leaves, we don't always know why they left, and we don't always know what their experience was here on the whole. We know what we did for them, and we know what services they got, but we don't know if they, loved what we did, or if they had questions or needs that we never fit. So, as a whole, we are doing a bit of that satisfaction survey collection work, but we also want to do more of that going forward, just so we have a better sense of whether or not we're actually living up to our goals and actually having the impact that we want. So for now, I don't see any other questions. It's also 12:35. So I think for now, we can finish this webinar for now. So thank you all for attending. Beyond this, we've been recording this webinar. We will send out a recording of this webinar after this presentation is closed. We'll also send out a copy of my slide deck. If anyone has any other additional questions on this presentation, the data work at St. Mary's, or anything else, I'm just very quickly typing in my email in the chat. So if anyone has any other questions, feel free to send those along to my way. Being at St. Mary's for more than 4 years, I have a lot I could talk about when it comes to how we do our data and my experience here. Thank you all for attending this presentation today. And just be on the lookout for a follow-up email with this recording and slide deck. So, okay. Thank you, everyone, and I hope you all have a great day.